Hi everyone, and welcome to the first webinar of the series that I'm putting together to inform family members, sponsors, and friends about different topics in relation to substance use. My name is Julia Horan. I have my master's in public health degree, and I am the Linkage to Care coordinator for the Connecticut Department of Corrections. In the first webinar topic that we are going to go over is what are opioids, because I feel like we talk about them a lot, but we don't always take the time to break down kind of what they are, how we name them, and what they do to the body. So, welcome. So behind my head, you can actually see a picture of an opium poppy plant. And opium is derived from that plant that you see right there. And that is a chemical that is used to make opioids. And opioids are used either a derivative of that natural chemical, or it can be a synthetic or a semi-synthetic opioid as well. So opioids work by binding to the pain receptors in the brain and body, and they basically block the pain signals from being received. So that's how the relief is felt, because no pain signals are being transmitted, so no pain can be felt. While they block the pain, they also release large amounts of dopamine, and dopamine is that feel-good chemical in the brain. So oftentimes this is why people feel like they want to continue using opioids, because they feel good and they're also not feeling any pain. So kind of the double benefit there. Opioids are used often to treat post-surgical pain, but they can also be used to treat, chronic pain, severe pain from disease or trauma. They can also help with coughing and diarrhea. And usually they're administered through a pill, which is orally, or there's also some skin patches, or intravenously through injection or IV during surgery. Commonly morphine is administered that way. So going off of that, I thought it'd be helpful to go over some common names of commonly used opioids, so we know exactly what we are talking about. One commonly used opioid is oxycodone, and the kind of brand names for that would be Oxycontin or Percocet. Hydrocodone is another popular one, which would be Vicodin. Oxymorphone, which is Opana. Hydromorphone, tramadol, codeine, morphine, fentanyl, and heroin are also commonly used opioids that you may have heard of, and these all fall under this category. So I thought this was a very helpful graphic to kind of show how we've gotten to the problem that we are facing today. The history of opioids kind of have three distinct waves that we often highlight. And so this graph shows deaths per 100,000, as well as kind of the timeline of the three different waves. And so the first wave was driven by prescription opioids. This started around the 90s, when pain kind of became the fifth vital sign in checkups, and that really advocated for pain relief options, which we answered with opioids. So in this time frame, a lot of people were being prescribed opioids. We didn't really know the exact dangers of them, and that's when we started to see overdose death rates from opioids beginning to climb, because we were prescribing so many and they were dangerous, but we didn't know that at the time. Wave number two, because we finally found out that prescription opioids were so dangerous, we then tried to make it harder to get these prescription opioids, but for most people the damage was kind of already done, and a lot of them were already addicted to said pills and opioids. So this is when people kind of transitioned to using heroin. So that's the second wave. In the 2010s, people who had their prescription drugs cut off from them often transitioned to heroin because it was A, cheaper, but B, honestly, at that point, easier to get. And then lastly, which is the main issue we see as of late, is the rise of synthetic opioids, namely fentanyl is a huge problem because minuscule amounts can cause an overdose. So we started seeing that first around 2013. But as you see, that purple line just keeps climbing up and up and up is because of those synthetics that it only takes a little bit to cause an overdose, and that is the problem we're facing now, especially with fentanyl. So now that we've covered kind of what opioids are and how they work, I want to go over some negative side effects of opioids that aren't necessarily addiction. One is that you will get an increased tolerance over long usage time. So that means that you'll need more to get the same effect, which often leads to addiction because you're kind of upping your intake. Physical dependence is another negative side effect. So once you stop using the opioid, you will get very sick, maybe, and experience withdrawal. This also gives increased sensitivity to pain because it is blocking those pain receptors so much. You kind of get used to almost a numbing feeling. So then with other pain, if you aren't using opioids, you are more sensitive to that. It can also make you feel constipated, give nausea, vomiting, and dry mouth, sleepiness, and dizziness. It can make you feel confused. It is a depressant, so it could increase depression. Itching is a side effect, sweating, and low energy is another one. So I do want to dive in deeper to these three terms because there are at different levels of um, your body changing to your usage of opioids, and I thought it was important to kind of decipher the differences. So tolerance or increased tolerance in this case is needing higher or more frequent amounts to achieve the desired effects. As I said before, after you use them for a long amount of time, they won't, yes, well, your body will just get used to using them all the time. So after a while, you'll need more to get the same effect. Dependence is when neurons are trained to only function normally with the presence of this drug. So your body does change, especially in the brain. And after a while, it won't know how to function if opioids aren't in the system. So physical dependence is a really big issue with long use of opioids. And then addiction is a chronic disease with compulsive, uncontrollable desire to use the drug despite harmful consequences and changes to the brain. And it can also result in harmful behaviors by the one using. I definitely want to stress that this is a disease. It can affect anybody, and often, they're left uncontrollable, just need to fill their void of this drug, and it can be very harmful, but it's not really a conscious choice that they're making. Their body has just changed and become so dependent that they need to get it, and it doesn't matter what they have to do to get it. So now I want to move on to treatment options for opioid use disorder. We've talked about how they bind to the brain, but I also want to highlight how some treatment options also bind to the brain in the opioid receptors. So there's three commonly prescribed treatment options. We call them MOUD, or medication for opioid use disorder. The first one on the slide is methadone, and this binds to the opioid receptors and eliminates withdrawal symptoms and lessens craving. So as you can see, it fully binds to that receptor and generates a little bit of an effect. Buprenorphine is another option, and it binds but doesn't completely activate the receptor, so it reduces cravings and withdrawal symptoms. But as you see, it's not a full bind, so it's a partial agonist, and it generates just a limited effect. as an opioid would. And then lastly, naltrexone just fully blocks the activation of opioid receptors. So if you see, it's kind of just in front of that opioid receptor. I will say that there isn't as much research in naltrexone, so the more commonly prescribed ones are methadone and buprenorphine, but they are trying to increase access to naltrexone and research, and these are all different treatment options. Um, I will say medications for opioid use disorder are highly effective and are a reason why a lot of people are very successful in recovery. Um, so I highly recommend, talking to doctors and kind of getting information about these treatment options. I will say there's different guidelines for how long you have to be kind of off an opioid to get onto one of these. So definitely consulting a doctor and figuring out what the best choice is imperative, because there's different time frames to initiate the treatment, and they want to figure out what would be best so the patient won't get sick or have any withdrawals. So I do want to relate this back to Connecticut in general, how the state is being affected by opioid use disorder and overdose deaths. So the overdose death rate actually increased 11% from 2020 to 2021 in the state of Connecticut. 93% of the overdose deaths did involve an opioid. So you can see that opioids are the main force of death rates, overdose death rates. 60.1% of overdose deaths occurred in the residence, and I thought this was important to note because this shows that oftentimes the overdose is happening in the household, and so I think this shows there's an opportunity to get family members, friends, sponsors, anyone who would be around and in the residence also armed with Narcan or naloxone so that they could reverse an overdose if anything does happen. And lastly, just a note that males tend to have a higher mortality rate, and especially in Connecticut, it's almost 3 times the rate. So they have a mortality or overdose death rate of 62.7 per 100,000 versus females with a 22 per 100,000 death rate. I did wanted to go over kind of different other treatment pathways and options other than the medications for opioid use disorder I highlighted in a different slide, because not one way works for everybody and everyone will have a different preference. And so I think it's important to kind of talk about that there is different pathways and you don't have to go the 12-step or the medication route. And there's other ways that will work for different people. So I thought this would be a good slide to go over, and this is from CCAR, who are great recovery coaches in the state of Connecticut. But there is 12-step, non-religious, spiritual/religious. There are medications, which I went over previously. There's wellness routes, so doing yoga or meditation. There's communities. Phoenix is, I think, a really cool one where it's kind of focused around working out, but it's kind of a fitness community. And then lastly, there's solely online ones. In the Room is a popular online recovery group. I did want to mention the signs of an opioid overdose, just in case you ever, hopefully you never do, but in case you ever come in contact with someone who is overdosing, so you know what to look for. And hopefully we will get you connected with Narcan or naloxone so you can successfully intervene. But the signs of an opioid overdose is, number one, they'll be unresponsive. So if you're yelling their name, a good way to tell is if you make a fist and shake down hard on their chest. We call that a sternal rub. We do not recommend throwing water on them because that is dangerous and they could drown. A second sign is that they might have pinpoint pupils, so the dark part in the center of their eye could be very, very small. They could also have slow, shallow breathing, or their breathing could have stopped. They also could be making a choking, snoring, or a gurgling sound. We call that the death rattle. And then lastly, their skin tone could be very pale, or they could have a bluish tint to their fingertips and lips, or if they're darker in complexion, that could be kind of a grayish tint. And lastly, they could be cold to the touch, so they'll have very cold skin. So I did want to go over two ways to either intervene for an opioid overdose or prevent one from occurring. So number one is naloxone. That is the brand name Narcan, and it is an opioid overdose reversal. So basically, it binds to the same receptors in the brain that the opioids do, but it blocks it. So it blocks any binding from happening, which is how it reverses, because the opioid is what's making them not be able to breathe and overdose. So that is a nasal spray, but it also comes in an injection. But the nasal spray is what most community organizations are giving out because it's a little bit more user friendly. And so that long part will go up the nostril, and that part underneath is a button, and you just press that button and it will spray it up the nostril. So that will reverse an opioid if it's already taking place. So fentanyl test strips, though, is to prevent, hopefully, one from happening, since we talked about earlier how fentanyl and synthetic opioids often are driving the opioid death rates because such a little amount can cause overdose. So they have made test strips where you take some of the drug supply and dilute it in some water, and then you take the little strip and put it in for, I don't remember exactly how long, but it will test to see if any fentanyl is in the drug supply, because often it's been laced in other drugs that people aren't even looking to use fentanyl, which is why they're accidentally overdosing. So this is a good way to kind of test. It won't say exactly how much is in there, but at least give you a heads up that there is fentanyl in there. So hopefully it will change people's mind from using it maybe, or maybe they will use with someone else in the room, just so a little bit of a harm reduction tactic there, to try to be at least a little bit safer when fentanyl is present, because that is a very dangerous drug. And then, as I just mentioned, um, fentanyl test strips are a harm reduction uh, tool. Some helpful resources are one, the National Harm Reduction Coalition. They're based out of New York, but they are very helpful. They have a lot of great resources about different topics and how to get different tools and materials so that you will not hopefully prevent an opioid overdose. Next Distro is a great resource to help find naloxone resources in your community and other information. SAMHSA is very helpful information. You can find providers in your area that prescribe the methadone and buprenorphine that we were talking about earlier. That's helpful to find treatment sources. Naranon, I wanted to put in here because I know family also need support and also need education and also need people to lean on and talk to. So Naranon family groups are very helpful, and I would highly recommend checking them and Smart Recovery out. And then lastly, 211 Connecticut is a great resource for really anything that you need in Connecticut. If you go on the website page, they have all these different topics, and you can even search for anything else that you might need. But they are great for, treatment sources, housing sources, support group sources, rent assistance, electric assistance, transportation assistance, things of that nature. So I highly recommend checking out that resource. And here is my reference slide. All of the information has been from a cited source, so in case you want to check any of that information out, these are the links to that. And lastly, I just wanted to thank you for watching this webinar and hopefully learning something. And if you ever need any answers to questions about substance use or harm reduction or treatment or naloxone or things of that nature, you can always contact me I put my email and my phone number up on the slides. So thank you again, and I hope you have a great day.